Air pollution ranks as the fourth leading health risk factor for premature death worldwide, contributing to an estimated 1 in 8 deaths, with the highest death rates occurring in the global south. Cities in India are amongst the most polluted globally. While the outdoor air quality in these regions has been scrutinized for several decades, the issue of indoor air quality is often neglected, despite humans spending the majority of their time indoors. Indoor air quality is a critical yet frequently overlooked aspect of environmental health. In collaboration with the University of York and funded by the York Environmental Sustainability Institute (YESI), a series of workshops have been conducted to address indoor air quality challenges in the global south. These workshops aim to educate and empower students and communities or vulnerable groups to take proactive measures to improve the air they breathe. Common sources of indoor air pollution include fumes, mold, tobacco smoke, chemical emissions from household products like mosquito coils, liquid repellents. Dr. Dorpon Das serves as the principal investigator of this project, with co-investigators Professor Nicola Koslow from the Department of Environment and Geography and Professor Kamran Siddiqui from the Department of Health Sciences. Our external partners include Dr. Deepanjan Mojumdar, Senior Principal Scientist, CSIR NIRI, Kolkata; Dr. Saifi Izhar, Assistant Professor, IIT ISM Dhanbad; Dr. Gitismita Nayak, Assistant Professor, All India Institute of Medical Sciences, Kollani; and Dr. Indrani Ghosh, Assistant Professor, Adamas University; and The Climate Thinker, an NGO dedicated to preparing current and future generations for climate change through sustainable development, circular economy practices, and policy advocacy. Together, they have strived to bring meaningful improvements to indoor air quality and promote healthier living conditions for all. The questionnaire was conducted in two cities of India, Kolkata and Dhanbad, to capture a diverse range of indoor air quality perceptions and conditions among vulnerable groups. The primary objective was to capture and analyze a wide range of perceptions and experiences related to indoor air quality and its associated health impacts. To achieve this, a quantitative questionnaire was developed consisting of 78 questions divided into 7 sections: awareness about indoor air quality, health impacts from poor air quality, sources of indoor air pollution, actions taken towards improving indoor air quality, household details and activities, awareness of health impacts due to smoke-related activities, and usage of different fuel types. The data was collected through one-on-one surveys conducted in person. A total of 145 individuals were approached across the two cities, ensuring a diverse sample in terms of age, gender, socio-economic status, and household type. The number of respondents varied for each question due to differences in individual responses and willingness to answer specific questions. This structure was designed to provide a comprehensive view of the various factors influencing and influenced by indoor air quality. Many low-income households struggle to afford clean cooking fuels like LPG. As a result, they turn to cheaper, more harmful alternatives. The rising cost of LPG makes these clean options even harder to access. The workshops not only provided a platform for knowledge sharing, but also highlighted the importance of raising awareness among communities about the risks posed by indoor pollutants. Understanding the sources of pollution, how they impact our health, and what actions can be taken were key focuses of these sessions. During the workshops, several low-cost air quality sensors were demonstrated to the participants, allowing them to actively engage with the technology. These sensors provide real-time data on indoor air pollution, empowering individuals to monitor the air quality in their homes. Selected participants were given the sensors to take home where they collected valuable data on indoor air conditions. This hands-on approach enabled participants to gain practical experience and understand the importance of indoor air monitoring in their daily lives. Beyond financial barriers, cultural practices also contribute significantly to indoor air pollution. The sessions held at IIT ISM Dhanbad were another critical part of our research initiative. Here, students, faculty, researchers collaborated to analyze and interpret the data gathered during the surveys. The aim was to understand the perceptions and real-world challenges faced by vulnerable groups. Our goal is not just to identify these issues, but to bring about change through education and awareness. These workshops, surveys, and research initiatives serve as an essential first step in improving indoor air quality. However, the challenges are multifaceted, from financial and technological limitations to cultural practices and policy gaps. We believe that addressing these issues requires a comprehensive approach that includes technological innovation, community-driven solutions, and targeted policy interventions. Together, we can bring this critical issue to the forefront and work towards a cleaner, healthier environment for all. As this project continues, we look forward to expanding our research and outreach with the ultimate goal of improving lives by improving the air we breathe indoors. Because in the end, the air we breathe should nurture us, not harm us. Together, we can make this a reality.